Nearly a third of Americans have never heard of fibromyalgia. It's a chronic pain disorder that can really affect every aspect of your life. But what's surprising is 10 million Americans live with this disease every day. So this morning we're learning more about it with Dr. Jennifer Caudle. Doctor, good morning. How are you?
I'm great. How are you?
Okay, so we know it's a pain disorder, but get a little bit more detailed. What is fibromyalgia?
Sure. Fibromyalgia is a pain disorder. It's a pain syndrome, which means that people have pain with this condition. It might be different parts of the body, it might be the entire body, and it might come and go, but the pain tends to be very severe. I've had patients tell me they feel like they've been hit by a bus or they feel like they have flu-like symptoms, so it can be very severe. But in addition to having pain, these patients often have other symptoms such as headaches, insomnia, fatigue, depression, anxiety. So it's really the combination of both pain and other symptoms as well.
Now, what is the cause of this? How does somebody get this?
That's a fantastic question. As you mentioned, approximately 10 million people in this country are living with fibromyalgia, and many actually have never heard of it. 1 in 3 have never heard of the condition. Fibromyalgia is a condition that we don't entirely understand. Research is underway, but we don't exactly know why people get fibromyalgia. We know that 75 to 90% of people who have this condition are women, usually women between the ages of 20 to 50, in age, but we don't exactly know why. And what people do have with fibromyalgia is they have this sort of hyper-responsiveness to pain, meaning they feel pain a lot more strongly than, say, you or I if we don't have fibromyalgia.
Now, if somebody at home is thinking, you know what, I think I could fall into this category, what should they do?
Oh, this is something I often say. I say this to family and friends, especially with patients. I really feel that people know their own bodies. And if you think that something is not right, whether you have the pain, whether you have the other symptoms, the fatigue, the headaches, the depression, anxiety, the first thing you should do is talk to a doctor that you trust. I think it's really important to keep in mind that fibromyalgia can be a very complicated condition. It's very complex, so sometimes it's hard to diagnose, and every patient can be very different. At our website, osteopathic.org/fibro, there's a survey that you can take to sort of evaluate your symptoms and take into your physician and really have a further conversation. But the idea is to talk about it, and then if you do fall into the category of someone who has fibromyalgia, really then to talk about the solutions.